going back to the original topic. So I'm a lower back tattoo. And how does that work when you do a 360? Is it possible for it to be gone? Because I would love it to be gone.
So yeah,
So,
those depends on where it is, right? I mean, I generally I think you'll have kind of different opinions on this.
okay.
I generally am going to put my incision where I want to put my incision. I mean, I want to give you the best result, right? So I don't want to move it 2 inches up because you've got a tattoo that you want me to remove. And I explain that to patients, right? I think most of them welcome that. Um, I think you have other surgeons who might say, well, yeah, let's move it a centimeter or two up, and but then your scar is like showing outside of your bikini line. So um,
Fair.
unless someone tells me they're okay with it and we've talked, we've had a conversation about that, I'm going to tell them this is where your scar needs to go. And then I will tell them this tattoo is going to go away. This tattoo, we're going to cut halfway. You're going to get like the top half of the flower or, Winnie the Pooh or whatever you've got on your back.
Hey guys, it's Mel, your host of the Cutting Edge podcast. This is a show where we talk transformation from every angle: body, mind, and confidence, with a little sparkle and a whole lot of truth. I'm joined by my amazing co-host, Dr. Omar Beidas, and the Plastic Surgery Pro, and Ashlyn Douglas Barnes, our go-to therapist and mindset queen. Now, quick disclaimer, none of us are your doctor or therapist. We are just here sharing real talk, real stories, and real growth. So grab your protein shake, settle in, and let's get into it. This is The Cutting Edge.
Hey, it's Ashlyn. Just one more thing before we begin. I will be sharing some of my own plastic surgery journey, which is personal to me and may not reflect what others go through. And if you're a current client of mine, please talk with me first before listening, because knowing personal details about me could affect your therapy. And your well-being always comes first. Now on to the show.
Welcome back, everybody, to the Cutting Edge podcast, where you get to learn all about the cutting edge when it comes to plastics and nutrition. I'm your host. My name is Mel.
I am Ashlyn Douglas Barnes, licensed clinical social worker.
Omar Beidas, plastic surgeon.
Perfect. And today we're going to be talking about, how do you even choose a surgery? What do you do? How do you go about navigating that? So, because even I have a ton of questions about my own personal journey when I go into that. So I have no idea how to pick it. So Dr. Beidas, can you help me and everyone else on how do we choose what plastic surgery to get?
So that's a great question. I think every patient is going to approach that differently, and we can hear Ashton's viewpoint. But for me, I generally, for the most part, I'm going to let the patient run the conversation. So people come in, they may tell me, my main concern is my belly. I don't want to talk about anything else right now. Okay, great. Let's talk about your belly. But even in that, for me, I'm going to tell them, we can't look at the belly alone in the sense that, I don't necessarily need to talk about breasts with that patient. But if we're looking at belly, I do think we need to think kind of bigger picture like trunk, right?
Okay.
So if I take a patient and they have a lot of fat deposits like in the side, and we were talking about a tummy tuck, and I don't warn them that, hey, we can do a tummy tuck, but the result may not be exactly what you're looking for, or you may not get the best result if we stop there and don't do a 360 or maybe an extended tummy tuck, which goes off towards the back, or a lot of lipo of your flanks if you're really wanting a waist. And so for that, even if a patient doesn't necessarily specifically bring that up, I'm going to tell them, this is something I'm telling you is going to enhance your result, and you may be unhappy if you stop at the tummy tuck, for example. And then at that point, I leave it to them, and a lot of patients will, sometimes they will kind of harp like, well, what do you recommend? And I was like, well, my recommendation is to do what I'm telling you, otherwise I wouldn't be bringing it up. But at the end of the day, if your goal is just to address your tummy and you'll be happy if you kind of aren't looking at your back or aren't looking at your flanks, then do the tummy tuck. But if your goal is to look as the best as possible, or this is going to bother you, then I think you should do the whole trunk, right? So kind of looking at it as a unit.
Yeah. And I'm glad that you do that, because I do have a friend in the community and it's a guy that he actually did not do the 360, and he is very upset about his results because he has, what do they call them? They call them ears or something? Or
Dog tag.
Yeah, I hate that. term?
I
Dog
know.
ears, they call them.
Dog ears, yeah.
I don't know who came up with that,
I was
but
gonna say, why is that even called dog ears? It's not even
I
near
think
the head.
I think they look like dog ears. Like the
Okay.
extra tissue that hangs on the side.
Okay.
And generally it is as a result of not making the incision or the scar long enough. So
Mm.
essentially that is almost proof that yes, you needed to make that scar longer to get rid of the dog ear. So that patient needed maybe an extended or a full 360.
Yeah. Well, and what would make the difference between an extended and a full? Like, I know what it would look like, but why would someone do one versus the other?
It really ultimately comes down to how much loose skin there is, right? So
Okay.
the tummy tuck in any woman, right? I mean, most, let's say, moms who've had one or two kids or three kids are okay getting a standard tummy, again, nothing is totally standard in plastic surgery, but what most people would call a standard tummy tuck is a scar from hip to hip.
Okay.
Um, a lot of surgeons will call anything past that an extended.
Okay.
My regular tummy tuck, because I do a lot of weight loss patients, is side to side. So already my regular tummy tuck is what most would probably call an extended.
Got you.
And then for me, anything past that, so if I have to flip the patient, that to me is an extended, or like I call it like a 270. And then certainly the 360 is where it goes all the way
All the
around and
way.
meets in the back. But essentially, sorry to go back and answer your question, the the amount of skin removal is what determine, or the amount of loose skin, extra skin, is what determines the length of the incision, right? So the more loose skin, the longer the scar. Hence, again, most weight loss patients need call it an extended, call it a side to side tummy tuck, but the regular hip to hip tummy tuck is not going to be enough.
And I wish that my original plastic surgeon had brought any of that up, because he did a pandectomy and I ultimately really needed the reverse on the top. So I really needed like a full on fleur-de-lis with muscle repair, and none of that was done initially because he thought I could get away with just doing a pandectomy, and I was really unhappy because I had a lot of loose skin in the top and ultimately had muscle repair that I didn't even know I needed or had until I had the revision done many years later,
Oh,
like 10
wow.
years later. Yeah. And then I even needed a revision onto that because I had so much skin on the top, and I probably could pull some more even now. But I yeah. And it's interesting because I'm trying to remember our conversation around it. I mean, I asked him about doing a 360, and that was that weird conversation where he only does so much scar line, and he felt like that was too much scar line. Which I still don't understand. I've never had another surgeon pull out tape and figure out what how many inches of scar line I was going to have. But, and I do think I probably would have benefited from a 360, especially for the back. But yeah, I don't know. I don't know why he decided on a pandectomy. I think he just thought, I was young, I had no kids, so I probably didn't need muscle repair.
Yeah, I mean, so the thing with with weight loss patients though, is essentially the visceral fat that patients have carried for years and years, right? Even men can't get pregnant, but they can stretch their abdominal wall and their rectus muscles. And so the visceral fat, that's the fat that's internal around your intestines and your liver and things like that. That's fat that will stretch your abdominal wall just like a pregnancy would. So
Oh.
even if you've
Yeah.
never had kids, or you're a male, you can have, either we call it laxity of the abdominal wall. That's where everything just kind of stretches, kind of like your skin, right? Your skin stretches. Well, everything underneath stretches too. It's not just a skin phenomenon. And you can get that rectus muscle separation. And then when you lose the weight, that doesn't come back like this. It still stays stretched and separated. So, I've done many 20-year-olds who've never had kids, and we still go in and find an 8 or 9 centimeter diastasis. It's, I would say, unusual to do a paniculectomy on someone like that if they need, if they've had weight loss.
Yeah,
So,
it's interesting that way too. And I think that I also had several abdominal surgeries, like OBGYN, and I had a hiatal hernia repair. I've had a lot of abdominal and my gallbladder removed. So I don't know if maybe some of that muscle repair had to do with the numerous abdominal surgeries that I've had over the years.
can you explain what a pandectomy is versus a tummy tuck? Are they the same? Hey friends, this episode is sponsored by findabariatrictherapist.com, because bariatric life is full of ups and downs and everything in between, but you don't have to go through it alone. Findabariatrictherapist.com makes it easy to connect with therapists who truly understand your journey, the mindset shifts, the identity changes, and all the real-life challenges that come after surgery. Because therapy designed for bariatric patients changes everything. Visit findabariatrictherapist.com and find your support today. They're not the same. See? I need some help.
Yeah, they're not the same. So, and paniculectomy is such a difficult word. I think people often struggle with it, but it's essentially the part that insurance covers, right? So, the hanging skin, they call it a paniculus, and so that's why ectomy is removing that.
Okay.
And it is really, the scar again is going to be as long as it needs to be to get rid of that loose skin. It is specifically, although again, surgeons might use that term differently, but if you look at the insurance definition, it is removal of skin beneath the belly button.
So it's literally just that lower area.
Lower area.
Okay.
It doesn't include muscle tightening. It doesn't include repositioning the belly button. As a matter of fact, often, just like in a tummy tuck, we can take the skin off from the bikini line all the way up to the belly button. And then we pull the new skin, everything above the belly button, we pull that down, and then we bring the belly button out through a new hole. Well, insurance isn't covering all that. So you can kind of take away this, call it like a diamond piece of skin or like a football shaped piece of skin. Sometimes you take the belly button with it and then you just pull it down and close it. But there's nothing else really being done. So it's not an aesthetic procedure in any sense.
Does not sound like it.
My insurance didn't cover it. I paid it again. It's like why he picked that. I don't really know. I think he was just hopeful we could get away.
So you paid for it, and okay, well that's an interesting choice to.
Yeah.
No,
there
was no insurance. Like my insurance had zero, none. Like from the get go, we were not gonna get it. And again, I went in there and was like, "You tell me. I have no idea. I just need it gone because it's really annoying."
Yeah, the only time I've done that on a patient who got denied, say, was someone with a very high BMI, who, it was affecting their mobility, and they knew this was not cosmetic. We're talking a BMI of like 38, for example, and they just wanted that roll of skin gone. And even then, a lot of times we'll still do the belly button repositioning, but we won't tighten the muscles, for example, because again, in general, if you have a BMI of 30, you're going to have a lot of that visceral fat. And so it doesn't make sense to try to tighten those muscles, because the analogy I make is it's like trying to kind of close an overstuffed burrito. You just can't, or it's going to pop open again. So it just doesn't make a whole lot of sense to do that.
140, maybe 145. So I mean, my BMI was well within normal.
Yeah.
I don't know. I have no idea. I'd love to sit and pick his brain and be like, hey, I'm just curious. No, especially knowing what I know now and the extent of what we've had to do to kind of get it where it needs to be.
So I'm going to ask another question. When you had that, did they reposition your belly button or no?
They did.
So it's kind of a paniculectomy plus. It's like basically everything for a tummy tuck without the muscle tightening.
That's what it sounds like.
I don't know. Actually, but then it's weird. Why did he bother to muscle repair? Like it must have been there.
It would have been an extra like 10 minutes.
It's just weird. I don't know. And I mean, I had a breast dog at the same time, but I had no lift or anything because I had nothing to begin with. So like he literally popped those in and then did my stomach. So it's not like he was doing something extensive breast wise.
Ashlyn, if you could go back, what would you tell yourself?
You know what? I don't think we actually had the cost conversation. So I don't know if maybe he thought like from an affordability, like this was going to end up being the most affordable thing. I don't think we actually had, because he didn't control any of that. That was like the business office.
Right.
So there might have been where he was trying to make more affordable. I don't know. Like in the end, the surgery I had, first off, I would have gotten lipo much sooner.
Okay.
I was terrified of lipo. I thought it was going to be like excruciating and terrible. And it literally, I do lipo tomorrow. I don't really care. Like if I ever needed it again, I would like sign up for that immediately because that was amazing. It did what I needed it to do. It wasn't any worse than anything else I've ever had. So I would have done lipo earlier. I would have gone and got the fleur-de-lis. I was really nervous about the up-down scar. I don't know why. That's the best scar I have in my entire body. I think we talked about this last time, that it's because of the like gravity essentially isn't like pulling it like the up and down scars are. But I was not going to get any kind of results that I eventually got without having the reverse tummy tuck, the top part done, and it being all the way extended into my arms. Like I think if someone had sat me down and just been like, your body shape is going to need very different work and very different eye than probably what you've ran into, it would have been helpful for them to be like, you're seeing other women that got like a tummy tuck and got everything they needed. You are not them. Like your body holds, and I knew I held weight weird. I knew that I had, because I had that like tier 1, tier 2. So
Okay.
like I had full on like
So you
the
had like
bottom part.
here and here?
Yes.
Okay.
And
So we go
very
boobs,
distinct.
then mid, then bottom.
Yeah.
Got
And
it.
it had
Okay.
a very distinct like
Yeah.
where each ended. And so I think if they had been, I think the first surgeon's hope was like if you could just pull it down, it would look better.
Look
That
at
But it
surgeon didn't have a
didn't.
lot of experience with weight loss
Yes,
patients.
it made it worse. And then I went and got cool sculpting. Good gravy. We should talk about that.
what is that?
Cool sculpting is an absolute waste of your money. Anyone listening to me, listen to me right now. I spent a lot of money and it made it worse. I don't know how it made it worse, but it made it worse.
If you're a
Maybe
weight
Dr.
loss
Beidas
patient,
knows.
yes, don't do
Yes.
anything non-invasive. It usually doesn't work. That's
So I thought
good
this
word
is
of it.
great. It's not invasive. I can do it on my lunch break. You know, all the things that they tell you. My hair removal place did it. So I was like, of course, yes. And it made it worse because they were trying to get that part right underneath. Instead of it being like 2, it made it 1. I don't know. It just made it look a lot worse. And
Can't
so
believe someone
is this?
actually and cool sculpting. So it's essentially freezing your fat. So
Okay.
it gets it to a temperature where it's so cold that the fat cells die, and then your body will kind of absorb them and take them away. The problem is, I would say probably 99.999% of weight loss patients, it's a terrible idea because their problem is excess skin. You don't generally have an excess fat problem if you've gotten into a good BMI range.
yeah.
And it's not
And
the
I had
same
a
as
weird
lipo.
neurological response where I needed to get onto oh, what the heck is that stuff called? The pain one that's specifically for nerve pain.
Oh, gabapentin or
Gabapentin.
Lyrica, maybe? Yeah.
Yes, I had a horrible reaction to it. It was super painful, and it was really strange because I don't get pain from any of that. It's
The
awful.
problem is a lot of these offices buy these devices and then just sell them to anyone who walks in the door, even if they're not good candidates, which is a shame, right? I mean, if I had a cool sculpting machine and you walked into my office and said, I want cool sculpting, I'd be like, you're a terrible candidate for this.
And I wish they would have told me that because I would have been like, thank you.
So I have some questions about this cold scoping. Is that what I'm hearing?
Cool.
Cool.
C-O-L-L.
Cool scoping. Okay, so
Sculpting.
Sculpting. So you say that it's freezing your fat cells. So do you have to? Okay,
It's
I'm gonna ask a really dumb question. Are they gonna put you in a cooler while they're doing this?
No.
Like what? How do we freeze our?
It looks like a vacuum.
Okay.
And it goes, they like draw this thing on and then they like, and it like sucks it in. And then you lay there for, I don't know, 30 minutes, 45
30
minutes.
I think, yeah.
Yeah. It like makes it really, really cold. It's not like unmanageably cold. I mean, it's cold. And then they take it off. They like massage it for 10 minutes. I think that was the worst part because it's really freaking cold.
Yeah.
And now they're touching it. And at some point they like changed something and then it wasn't supposed to cause nerve pain. I don't know. It did not work and it was very sad.
And 3 sessions, right? You have to do 3 sessions.
And altogether, I think I did 5 because we were hoping that there was just some magic that it was, I don't know, because they were going to sell me some more. And they gave me some free because they felt bad. And
it ends up costing maybe not as much as lipo, but
no,
pretty close to what
I
lipo would
spent
cost.
more money on that than I did the lipo.
There you
and
go.
I got everything lipoed for less than I. It was terrible.
I think it's probably becoming less and less famous now. But
yeah, no, I think it's pretty widely known. Like if you go on to Real Self, I think that's one of the lowest ranked procedures. I will put procedures in quote there. That's on Real Self. So Real Self is a plastic surgery website where you can rate people, you can read about other people's journeys, you can see examples of things, and It's interesting because I think there's good, bad, and ugly about that. Is you're going to find a whole bunch of people that don't look like you, who do not have the issues that you have, who do not have the like. I didn't understand that I have lipedema, so like my results are going to be very different than a lot of the people. A lot of them are not weight loss, like massive weight loss patients. I don't know, but it is interesting. I mean, and then you of course can get way too much information where it's like a lot of people said it was great and a lot of people said it was terrible. So like, what should I do? So if you look on like the liposuction section, you will find people who are like, I almost died. It was terrible. I've never felt so much pain in my life. And I had a, kidney transplant and 6 kids. And then people who are like, I went to work the next day. So it's really hard because everybody's experience is so different. Dr. Beidas, do you know the place that's it's not cool sculpting, but it's like lipo, but they just give you like Valium? It's in Lake Nona. Like actually right next to one of the
Sonobello?
Yes.
Sonobello?
What is that? My sister called and was like, I'm considering that. And I was like, I don't think so. Oh, I probably shouldn't have said that. But
there's a few of those places by different names, where essentially they do, they call it awake lipo, but different companies call it different things. I think.
Is it actually lipo while you're awake?
It's lipo. Yeah, and it's just under, I think they use IV anesthesia. So twilight, what some people call twilight anesthesia.
Okay.
And yeah, it's lipo. You're just not asleep. I mean, there's some plastic surgeons who do tummy tucks on awake patients. They put them under IV sedation. I think that's probably one of the more difficult procedures to do because there's muscle work involved, on an awake patient.
Yeah.
Facelifts have been done with IV anesthesia for some time. I think with very good results. Again, I think it's a little bit harder to get a great result when someone's asleep. Lipo is certainly hard. I mean, we do lipo in the office sometimes for like small areas. And you can tell when you numb someone, when you numb this area, if your cannula comes right there, they almost, they kind of like twitch or jerk. And so you have to be very good with your numbing, which then limits how much you can put in, right? Because we have maximum doses of some of these medications. And it can get very tricky and it can be unsafe. So people who think that it's safer because there's no general anesthesia, it's kind of a false misconception.
Yeah.
So I had what they called back anesthesia. I don't know what that means, to be honest with you, but I woke up feeling so much better than I did when I had general. So it wasn't general, but it wasn't twilight.
Was it a spinal or like an epidural?
Epidural? That's what I'm thinking.
I don't think so because I could feel my legs when I woke
What's
up.
back? I've never heard of back anesthesia.
I don't know. Solera's office does it. The whole office does it because it's the same anesthesia. He was great. I loved him. He was the best anesthesiologist I think I've ever.
That's awesome.
I have no idea what he did, but I like woke up, felt great. I don't know what his name. He's much older. Like I told him he wasn't allowed to retire last time I saw him.
Nice.
Said, no
nice.
promise. No promise.
So should people not be going to the Sonobella places? Like I've never even, there's one in town. I just don't know really what a Sonobella place even really does, to be honest with you.
It's just lipo. It's just they're not doing it under general like they do in the office.
Correct.
Okay.
It's just lipo and it's, kind of more surgery suite based. I don't think there's anything wrong with it. I think what you have to be careful of, I would say, is making sure your surgeon is a plastic surgeon because there are a lot of cosmetic surgeons who work there. Those are the ones who could be like a general surgeon who went and did a weekend course and is now doing lipo. And then just making sure you like the results and they can show you a lot of before and afters. Okay. It is cheaper. It is a significantly cheaper because they don't have the anesthesia fees. But I would say make sure that person's doing things safely. And there are some, I know a few plastic surgeon colleagues who started their careers working at some of these places and are very good and safe, but not everyone is like them. So,
well, and that's a big deal because the cosmetic world and the plastic world, like there's like an overlap that really, I think personally shouldn't be overlapping, but it is, which I know that we're going to talk probably more into that on a different episode. Because guys, we need you to pick the right people. We want you to be safe. But when I'm my other question, going back to the original topic. So I have a lower back tattoo. And how does that work when you do a 360? Is it possible for it to be gone? Because I would love it to be gone.
So yeah, those depends on where it is, right? I mean, I generally, I think you'll have kind of different opinions on this.
Okay.
I generally am going to put my incision where I want to put my incision. I mean, I want to give you the best result, right? So I don't want to move it 2 inches up because you've got a tattoo that you want me to remove. And I explain that to patients, right? I think most of them welcome that. I think you have other surgeons who might say, well, yeah, let's move it a centimeter or 2 up, but then your scar is like showing outside of your bikini line. So
Fair.
unless someone tells me they're okay with it and we've talked, we've had a conversation about that, I'm going to tell them this is where your scar needs to go. And then I will tell them this tattoo is going to go away. This tattoo, we're going to cut halfway. You're going to get like the top half of the flower, or, Winnie the Pooh, or whatever you've got on your back.
What do you have on your lower back?
Oh, me? Okay, so
I don't want to say.
It's not Winnie the Pooh by any means, that's for sure. So people are gonna, I'm a nerd, so I love Eminem, like the rapper Eminem.
Okay, I was gonna say, do you have the purple M&M on your back?
No, that would be even weirder. No, so
is that like his M&M? Sorry, what?
No, he doesn't have his own M&M, does he? That I just don't know.
No, but why purple?
The purple, because that's the sexy M&M.
Yeah, that's the sexy
M&M.
That's
my favorite M&M. If I was gonna get an M&M on my body,
see the one with the long eyelashes?
Yeah, that's her.
Like seductive M&M.
I thought the girl one was green.
There is a green one.
Okay, she's just not the sexy one.
I'm gonna have to Google.
I think she's the sassy one.
Oh, sassy.
I think she's sassy.
Like the Spice Girls, they have 4 different personalities.
Right. You got to have all the different spiciness to it. But so Eminem it's called the Eminem Show, one of his albums, and underneath it is a really pretty like line work of just like swirls and prettiness, right? That just goes underneath. So I have that on my lower back. And then I should have just left it alone. That was like right when I turned 18, we all do stupid shit. And I had Dylan a year later, and I was like, oh, I'll put his zodiac sign in the middle, because like it comes into a heart. What Eminem's design is, it's a heart when it comes out. So I was like, I'll just put his zodiac sign in the middle. But the guy did it, 1, way too big, and 2, it got infected and everything. So it just doesn't look good anymore, like by any means. And I forget I even have it until someone's like, oh, you have a back tattoo. And I go, I do. And then like, oh yeah, I got a lower back tattoo. I'm really trying hard not to say tramp stamp, guys. That's just to let you know.
I had a feeling someone was going to say that.
I just figured I'll say it. Just get it over with.
I couldn't say it. It's inappropriate.
Because my mom.
Can you imagine if you're back there, you're like, hey, you want me to remove your tramp stamp? Like, I love that. I was hoping you would leave it alone. I think most people with tattoos are probably. I had a client one time that was like, oh, I need to get my arms done, but they'd have to chop my tattoo, so I just couldn't do that. I was like, you couldn't like reimagine it, like have them do some.
I mean, it's funny because especially in that area, and sometimes like women will have them on the side here, right? Some tattoos like on their outer chest. It's one of 2 reactions. I mean, I guess, right? There's no third reaction, but it's either, oh, thank God you're taking that away because I've been wanting to get rid of that, kind of like your situation, Mel.
Yep.
And others are very attached to them because it is a meaningful, tattoo.
Yeah, I'm like, we'll get you another one.
We'll get you another one.
I think it's easy when it all goes away or we can completely avoid it. I think the tricky ones are when we're like, oh, I'm gonna have to cut like through this, and then I'm gonna leave you with like the top half or the bottom half, or we're sewing 2 parts of your tattoo together, and how do you make that work? So.
But to me, it's like at that point, we're gonna have to deal with cover up. Like,
yeah, that's a whole new tattoo.
We'll figure all that out.
Yeah, had a guy I was
Winnie the Pooh and the bottom of Winnie the Pooh, and then we kill the stomach. Yeah. It's like his legs and his arms.
Well, I mean, we've gotten pretty creative. Like I had a guy who had a chest, a giant bird, like an eagle or something on his chest, and the bottom part here was his tail, but it was like huge. And we were doing a chest surgery, like taking off some skin, and I would say we realigned it pretty well. I mean, if you look closely, you'll tell something was off, but we kind of just shortened his tail and brought back the edges together.
So you are a tattoo artist too, and you didn't even do the tattoo.
Yeah.
Look at you making sure. I am a little nervous because I think whoever does my tattoo, whoever does my surgery, which I would love it to be you, but I'm afraid that the tops might have to stay there. That's
Top.
I'm
Yeah.
very nervous about that, which is fine. I can probably fix it, do something else. I just want it completely gone, to be honest with you. And it was funny because I went to this bathhouse in Ashland, which Ashland, we should go to Ashland and go to the bathhouse. It's amazing. But the deal was like,
Is it a nude one or you wear bathing suits?
You wear bathing suits there. Yeah. But like this is the area. So you go in and like in the women's area, you get completely naked, right? To like put on your stuff or whatever. It's like it's a small locker room. And I was in there with Bex, becoming Bex.
Yeah.
And she's had tons of surgeries, done plastic surgeries. And so like I looked at her and I was like, oh shit. I went when I'm like, nice tits, because like they're new and they're up and they're like, hi, you know, they're like headlights. And we were
You just said you were a bathing suit.
No, but this is in the locker room before we
oh,
yeah, we're
okay.
changing into the bathing suit.
Got it.
And
No
later on in the jacuzzi, we were talking and she's like, you know, I think when you get yours done, if you do a 360, your tattoo might be gone. And I was like, oh, I'm excited. And she's like, oh, you want it gone? And I go, yeah, like, I don't care for that artwork by any means. Like, I'm annoyed that I even did it. You know, I just did it because I now know I was doing it because all my friends were getting tattoos. And that was literally the only reason.
I got a tattoo when I was 14. It's the size of a quarter. It's on my back. Yeah, it's like a prison tattoo, like hand done.
Nice.
Prison tattoo. Oh,
so it wasn't done with a tattoo gun. It was like done in like a
by hand.
Prison tattoo. Yeah.
The thing with tattoos, I mean, the thing for weight loss patients also specifically is depending on where you got it, right? If you got it before your weight gain or after your weight gain, but before your weight loss, it's going to distort so much. I don't know, Mel, if that was your experience, but
no, because I got it after Dylan. So no, I didn't. I got the pre, then the after. I don't know. My back really like it looks the same to me. It's a little faded. Because like I carry more of my weight in the front. Like I carry that in like the lower tummy area. My back's actually pretty good. It's just that last spot. Like I'm like, well, if we do a 360, I want to know if it could be gone. And if so, like, would you change anything to make sure it's gone? Sounds like for you, no, you want to just, and that's fair. Like you want to have a nice scar and you want it to be exactly where it should be. And that's where I would want it too. I would actually probably do it. And then if you did it and there's just like a little spot left, I might just go get that laser removed.
I was going to say, there's other options to get them removed.
Like I know it's painful, but like, I think I can handle it.
Do you guys do that in the office, like while she's under? I know sometimes people get like facial lasers while they're under and they're doing something else just because it's painful and it's like you might as well do it under anesthesia.
Yeah, you can do a laser for it. I don't have that. We don't have a laser. I mean a tattoo removal wavelength because it's a specific wavelength, but also some colors are more difficult to remove than others. It depends on what colors are in the tattoo and what ink, and also like the type of ink that was used. I mean, sometimes this is when you find out that your tattoo artist wasn't using the best quality tools.
Yeah. Well, mine's just a black lines, and then it has like a little bit of blue for Dylan because he's a Pisces. So that's what I was trying to get, like the fishies or whatever, but it just didn't come out right. It's so bad to where like I have to tell you this just because it popped in my head. And I just remember being like drinking with my ex-husband, and one time he goes, look at my, because no one sees my tattoo because I was just leaned forward and I was playing cards and it was out, and he literally like pulls down the back of my pants a little bit and he's like, look everyone, and then everyone came over and checked out my lower back tattoo.
That sounds like your asshole ex-husband.
Yeah, right. That's something he would totally do.
Let me embarrass my wife in front of everybody.
Right? And then make jokes about the coloring, the way that it looks, all these things. And I was like, thanks, babe. That now it makes me want it gone even more. Thank you very much. But you know what? He now has my name on his bicep, so everybody gets to see it. And he even crossed out my name. All at the same time. He got my name put on him and the crossing out on the same session. So
He didn't have it before.
No, he didn't.
He got it so he could cross it out.
And he wanted me to do the same, and I was like, "You're fucking crazy."
From what you described, though, if it's low, unless you wear your pants like way high to your belly button, it sounds like it would come out.
Yeah,
Or
it's
most
pretty
of it would
low.
come
It's
out.
like right at like the little tail that comes like there's like a tail on the thing that goes like this, that kind of swishes and goes down. That part is like right above my butt crack. So
that's the bottom of it or the top of it?
the top of my butt crack. That's the
No,
bottom,
the top
but
of
that's
the
the
tattoo.
bottom of the tattoo. Yeah.
Oh no, then maybe not.
Right.
It depends.
See?
It depends.
We're gonna have to find out.
How tall is it?
I would show you, but I just don't know what would show.
Not on camera.
I think it's like this thick. Like
We'll
this
look at
tall.
it when
Okay.
we're done recording.
there we go. Yeah, it's like that much. I think it could be bigger. I don't know. Haven't seen it in a long time. I'm not back there. But now I know I do gain weight in my back more than I thought I did. So like that's a new. As we get older, people, please remember the body likes to put fat deposits wherever it wants to. And it might change from where you're used to getting it. And boy, did I have that lesson when I did my regain, because a lot of it was the back of me, not the front of me. So,
that's true. I think, I think it's probably worse for women because estrogen causes kind of redistribution, even if you don't gain weight, but just redistribution of fat overall.
What? Why?
Yeah. I mean, I don't think you're not at the age probably where this has happened, but I'm saying in the future, I think as you go through like menopause, that's when things start to like, even if you're the same weight, people start to notice that like their fat's not distributed the same.
That's annoying. Rude. Okay. Well, now we know estrogen does that. Thanks whoever created us.
How about like other areas like arms, upper backs? How do you know when you need a lift versus you're just going to put in larger implants?
Yeah.
Like lift versus like larger implants.
Yeah.
Lift versus larger implants. I think a lot of that is dependent on, the purpose of a lift. Let's start there, right? So the purpose of a lift is to lift the tissue, but mostly we're concerned as surgeons when we're looking at a breast, we're concerned about the position of the nipple, right? So is the nipple, you want it above the crease, right, which is kind of the base of the breast. That's the part that separates the breast from the tummy.
Okay.
And some people like it much higher. Some people don't mind if it's a little bit lower, but you don't want it should be above the crease. So it should be above the footprint of the breast.
Okay. Not pointing down. So like they currently are.
Absolutely not pointing down.
Keep going.
It's okay if they are. We're just talking about the purpose of a lift.
Yeah. Keep going.
So depending on how much of a lift is needed or where the position of the nipple is, that usually will help us or help guide us. Do you need an implant only to get that much lift? Like if the nipple's kind of like right above the crease and you have no volume, a lift might get it there. I mean, an implant might get it there. But if you have a lot of volume and it's pointing to the ground, as Mel, you were just saying, usually you need a lift, right?
Okay.
Now an implant, on the other hand, is something usually people use for volume. So it's going to give you a little bit of a lift, but it's not going to give you like a 5 or 6 centimeters of lift. That's like 2 inches, let's say. But it is going to give you volume. So if you come in and you're like, well, I'm an A cup and I want to be a D cup, you can't really do that with a lift alone, right? If no matter how much of that volume you lift up, the volume is the same. And so that's where we typically talk about implants.
So, okay. So like a person like me, like I'm a full C, but like I've been teetering around, like, do I put implants in? Do I just do a lift? Do I do the fat deposits? Like, because I don't really want them bigger. I just want them higher and pointing correctly. So
yeah, so that's really the questions that I will kind of ask a patient when they come in for a breast consult.
Okay.
Is going to be, what's your cup size now? And are you happy with the cup size? Right. So we need to know, because other people come in and they might have like double Ds.
Right.
And some of those want to be, I would say most patients coming in with a double D want to be smaller. I've seen occasionally some who want to go bigger. But so those are the two questions I want to tease out. What's your volume now? And where do you want your volume to be? So now I've figured out, do we need to go smaller? Do we need to go bigger? or do we really just want a lift? Because if they're like, I'm a C and I want to stay a C, then a lift is going to get you there. A lift is going to decrease generally maybe by about half a cup size. Even if we just take off, let's say, some skin, it's going to take you down half a cup size. That's something we can easily make up with some fat transfer, or most women are like, it's fine. I'm, half a cup size is not a big deal to me. Now you mentioned fat transfer. So like I said, we can make that up easily with fat transfer if it's like a small cup size difference. Or you can always go with an implant if they want to go bigger. Now, the one thing that I guess the two differences with those two, right? So fat transfer, number one, implant, number two. Fat transfer usually can only go up half to 1 cup size in one surgery, right? So it can be repeated, but you can only do so much in each surgery.
Do you think we'll get better technology and eventually we just will get rid of implants altogether and we could just transfer our own fat? Because boy, that would be lovely if we could just transfer.
I don't think so, because I'll get to the second point. I don't think so. For these 2 points. So the thing I tell patients is fat transfer can get you the volume, but it may take multiple surgeries. Like if you want to go from a B to a D, that's probably 3 surgeries. And then so an implant can get you from a B to a D in one operation, right? So that's where some patients say, well, I'd rather just do one surgery and be done with it. I don't want to mess around with 3 rounds of fat transfer.
Yeah, same.
On the back end, the other thing I also tell patients is fat is your own tissue. And you'll go on to get mammograms and, so on and so forth. But after those, let's say 3 surgeries, you're done for life unless you develop cancer, want a reduction, want to lift later on in life, right? So that is your tissue. It's not going to need to be changed. Implants won't last you forever. So for a 20-year-old woman, let's say, who's looking at implants, you're probably going to get another set of implants in your life before So I also tell patients to think of it that way. It's 3 surgeries in the short term, but it's going to be 3 surgeries in the long term for implants. Then to answer your question, Ashlyn, the second thing for implants that I think this is why they won't go away is that fat is always going to, even if we put it up here, it's always going to settle like normal tissue kind of with gravity, just like a lift. The lift is never going to give a patient, or fat is never going to give a woman like this upper pole fullness here, this roundness. And so that's the other reason I might use an Sorry? Yeah, some patients don't want that.
I wanted that because I didn't have that. That's so funny.
Yeah.
Some patients do. Like I have a lot of women who come in and they have old implants or they want implants and they want the fullness up here. And there's nothing else that, at least in our tissue that can do that or that can do that or accomplish that goal.
Because I was even like digging through my stuff because I was trying to, for some reason, I was thinking I had 550, which seemed like humongous, right? Like not possible that I had 550, though I did start with nothing. I might have even said that. So I like dug through my records. I don't. I have a 325 and a 350 high profile.
550 is a bit much for a woman who's not like a cancer patient. I mean, it's not impossible.
Right, but I had said that at some point, and then I was like, I don't think it actually was 550. Though I know it was a lot because I had nothing to begin with, and I had no lift or anything, and we were going actually to give a little lift through implant alone.
I'd say probably for an AUG, the average is like in the 300, 350, 300 range. I've put in 500s, but I'd say like for a recon, you're looking more like 600s the average.
Right. So for Ashlyn's sake, those numbers weren't exactly the identical. One's 325 and one's 350. Now, I know just by being a woman, one boob is always bigger than the other boob. But so is that really the reason for that? Am I understanding that right or no?
I think I also had a little more tissue on one side, or there was some weird thing that he was trying to equal out.
Yeah, I think a lot of, so as you said, Mel, every woman has some asymmetry, right? Not just in volume, but in where the nipple sits, where the breast footprint is. If you look closely, we examine the breast in like 3D, right? So we're lifting and looking at where the footprint is, and usually the footprint is often, most women, I'd say average is like a centimeter, right? Which is about this much. But some are off this much. And if you just look in the mirror, if you're naked and you're looking in the mirror, usually you can see it where it comes together in the middle. You'll see one crease kind of starts here and one starts there. So that's one of the things we also try to fix, whether we're doing a lift or a reduction or an implant, to try to improve that asymmetry. It's never perfectly symmetric, but we want to improve some of those asymmetries. And volume is one of them, as you noticed in Ashlyn's implant sizes. So I am someone who I prefer to use the same size implant on both breasts, and I'll usually make up the difference with fat transfer. So
Oh, there
I
you
think
go.
we might have talked about this in one of our previous episodes, but all of my augmentations, unless the patient has like no fat to liposuck, which is almost very, very rare,
Yeah.
we can always get even like 30 or 40 cc's. I will always do a hybrid augmentation. So I do implants and I do fat on top, and I'll put the fat kind of in the upper pole and the medial pole of the breast, which is kind of this area here,
Okay.
or in the central breast if that's where the volume is needed. But that allows me to do like 250s on both sides and then do like 30 or 40 cc's on one side, or even like 80 on one and 30 on the other of fat.
And where are you taking the
Um,
fat from? Like,
Usually the belly. I mean, we've taken it from other spots. Sometimes if we're doing like a mommy makeover, we'll do 360 lipo and then the tummy tuck and then do the breast dog and the fat transfer, for
I
example.
think when I had them done, there wasn't a lot of fat transferring happen because this would have been in like
so that's
2013, so about 12 years
12
ago.
years
So like
ago.
BBLs and stuff weren't a thing quite yet. You could get lipo and stuff, but I don't remember there being a ton of like
Fat transfer. I know they talked about it and they really wanted it, but I don't know when it really started.
when internal bra. So there's this surgeon over in Tampa, and he does the internal bra all the time. Like, what is
What is
that?
that? Yeah, I want to
I
know.
wish I had brought a show and tell.
Yeah.
So internal bra is people use it as a term to talk about, usually it's going to be a mesh.
I think so.
Yeah, there's different companies out there, and I think the word internal bra describes it pretty well, but think of it as like a hammock, right? So it comes in different shapes and sizes, and you can trim it and cut it however you want. The mesh I use sticks around for about 2 years and then it dissolves. Um,
Okay.
but it is essentially what I use it for is to support the implant as your body is healing your fresh incision, right? So, especially I honestly do it on every patient now, even if they're not a weight loss patient. But I think specifically for weight loss patients, it is very helpful because your tissue, we were talking about that skin and the abdominal wall earlier, right? And so similarly, your breast tissue, if you're a weight loss patient or a mom who had, 3 kids, right? Every time you get pregnant, your breasts engorge, breastfeeding, all that, and then they shrink. And so that constant stretching, shrinking, stretching, shrinking, damages not just the skin, but also the support structures of the breast. And so I think for weight loss patients, the mesh has been incredibly valuable, especially if we're putting implants in, because again, it's going to help support the implant as your tissue's healing. I think ultimately it's not a 30 or 40-year solution, but it's going to buy you some time, and avoid you maybe needing a revision in 3 or 4 years. It's maybe going to buy you 10 years.
Oh, nice. Do you do them on people that don't do implants, like just a lift or a fat deposit, or is that
I
no?
have, but less commonly. So I actually had a patient from out of state who'd come last year. We did essentially an upper body lift.
Okay.
So I did a revision of her previous brachioplasty, and then I did a breast lift and a back lift at the same time. And then she came back and her breasts had kind of like sinking down into her abdomen.
Oh,
And she
poor
was
baby.
a weight loss patient. And actually the nipples were still high, but just the tissue had fallen down. And so she was coming back for more surgery. She was coming back to do her legs. And so I told her, well, I told her, I'm not really sure what happened. I don't have a great explanation. But I think it's worth going in if you're not happy, doing some fat transfer. She didn't want implants. So I said, let's do some fat transfer to give you some more volume. And then let's put a mesh in because I think that should help support, your tissue. And so
Okay.
we just did that maybe last month.
Nice.
So DVD, hopefully
So
he's happy.
and I think you did a reduction today, right?
Yes.
So what's the difference between that and stalking you on Instagram? I love seeing what you're up to, though. You're always doing very much more interesting than the guy in Tampa who does boobs all day.
I know. We stalk Dr. Beidas for sure. I love knowing all the little things he's doing.
So what's the difference between like a reduction and a lift? You like lipoing? I don't even know. Like,
yeah, how do you?
It's probably semantics, but with both, you're going to get a lift. So both are
Oh,
going to
okay.
reposition the tissue and the nipple higher on the chest wall. And even in a lift, you have to remove something, right? Sometimes we call them like skin-only mastopexies, meaning we've only removed skin and no fat or breast tissue.
Okay.
Sometimes you do a mini reduction with the lift. But even in a lift, you're removing something, right? It could be like 10 grams, 20 grams of skin. That's probably the smallest lift I've done. Sometimes it's the whole lower pole. If again, someone is a D and they want to be a C, reductions, but also that could be a reduction, right? Someone going from a D to a C, we might call a reduction. So it's usually semantics. But if you're going from like a double D to a B, like today's patient was a G cup or something, and we took her down to a C cup.
Damn.
So
Her
that is
poor
a
back.
reduction. Yeah.
Her
Yes.
back's gonna feel so much better soon.
This girl's in her 20s.
Oh, poor girl.
Yeah.
Oh.
So that's definitely a reduction. A lift, again, is going to be a baby reduction or very, very little tissue removed.
Is for the reduction, is it still that kind of like keyhole kind of scar where you like bringing it in, or is it totally different?
So it depends, right? I mean, it depends on how much tissue is removed. I've done, younger women, good skin quality. They want it to go down like half to 1 cup size. The nipple's in a good position. We didn't need to do a
Worth
lift. I've done liposuction on patients just for reduction, right? You can go in and just lipo the fat. That is I would say that's a very rare patient, right? It's not like I'm doing this every day.
Okay.
And then other times it is around the areola and down. So we call that a lollipop incision, right? Because it looks like a lollipop. And then there's the anchor or keyhole one I think you were asking about. So it's that plus a horizontal scar in the breast crease or in the fold.
Oh, okay. So with the reductions, like you automatically get a lift, basically. Like there's no way around it.
Bingo.
Nice.
Correct.
Nice. Well, that's
I
always
mean, you
a
could
plus.
reduce it and leave the nipple pointing down, but I don't think any woman would want that. So
No, because before surgery, I was a triple D. And then with all the weight loss, I'm down to a full C. So,
yeah.
And I think we need to talk more about the skin removal because I've never heard anybody talk about, oh, I'm going to get a lift or a breast augmentation and skin gets removed at the same time. Like, I think we never really thought about it. Like, normally we're thinking, oh, we put a plant in, put it back together or whatever. But you really are removing skin at the same time.
So in a woman who the nipple's in a good position, doesn't need a lift. Again, that's not going to be most weight loss patients, but doesn't really need a lift, just wants an implant. You can do a straight augmentation, no skin removal. You're just making your incision to put the implant in.
Okay.
Most weight loss patients don't fall in that category. And I would say most weight loss patients, I would say it's very rare that I've done a breast reduction on a weight loss patient. I can't even think of a patient where I've done that on. And if it is a reduction, it's a smaller reduction, like not like the girl I did today, right? We're talking like going from a D to a C. Most weight loss patients are usually just wanting a lift or a lift plus an implant for volume or a lift and fat transfer for volume.
Well, this makes me more comfortable. I think I would want to do a lift with more volume, like just more volume, like fat deposit. Yeah, that sounds like something I would want to do.
And I think that's what most weight loss patients want, right? One of the things that's really hard is actually when we get a woman who's overweight or obese coming into the office and she wants a reduction, but she also needs to lose weight and might even be thinking about bariatric surgery. And I've had a few of those patients come in and I tell them, so it's kind of a catch-22, right? Because if I do the reduction and she goes on to have bariatric surgery, then let's say we've taken her from a G to a C or even a D. Well, now she's going to lose more of that volume and it's going to sag and she might get to a B and now she's going to have to pay on the back end for an augmentation lift, right? Versus, talking her through that and saying, you should really do your weight loss surgery or, do your lifestyle modifications, whatever, lose the weight. And then, yes, you'll need a lift and it won't be covered by insurance, but at least you're not doing 2 breast surgeries.
Yeah.
Unnecessarily. So.
And I would say one of the things that helped the most was actually the reverse tummy tuck. That actually made my breasts look so much better. Like I had a lot of people who thought I had an implant exchange when I had the reverse, because by removing all that skin, you could actually see what was there. And that actually made a much bigger difference than I thought it would. I didn't realize how much. I mean, I knew because I could like pull it and I could do that, but
You're like, I can play
um,
with it.
right, it's a lot. I mean, I even still have some, which is kind of crazy because we're like 2 surgeries in, and we removed a lot. It's just I had a lot of skin up there.
Can you
I think
explain what a reverse tummy tuck is?
me, Ashley.
Yeah, you can go ahead. Yep.
Yeah.
So it is basically the opposite of a tummy tuck, right? So with a tummy tuck, we're removing skin below the belly button. You're pulling the skin down, right? So your scar is going to be a bikini line scar. With a reverse tummy tuck, and maybe it's not the best terminology, but it's what someone came up with. It's a scar, kind of like that anchor scar in the breast footprint. So you can combine it with a breast lift or a breast reduction. It's the same scar.
Okay.
Or if you've had a previous one, you can reopen that same scar. And then you're cutting out tissue in the upper abdomen above the belly button. You probably aren't going to get all the way to the belly button.
Okay.
And there's generally no belly button repositioning. And I can't say that I've ever tightened the muscle through that incision, although you could, in theory, if someone only needed a reverse tummy tuck and didn't need a standard abdominoplasty, or maybe they had one before and they need some upper abdominal tightening, you could. For most patients I've done that on, it's been something I've either done after a regular tummy tuck or before a regular tummy tuck.
Okay.
We just don't do them together because coming from the top and the bottom, the blood supply now is you're relying on the blood supply from the sides, which can be a little less reliable, let's say.
Okay.
Yeah, I
But
think
the description. No, go ahead.
no, I was gonna say, I think the way that we ended up doing it is probably not the super norm. Then,
Yeah,
'cause
the
we
eye
did,
is a little unusual.
yeah, because we did a revision to the original appendectomy and went hip to hip, and then went up, and then went nipple nipple, and then when we went back to revise the top, instead of going nipple nipple, we went all the way into the armpit, which is what I thought we were doing it originally.
Why are we going into armpits? I need to know.
I had a lot of extra skin and it was making it really challenging. One of the biggest issues that I had when I lost all the weight, it was very hard to wear bras and it was very hard to wear t-shirts
Okay.
because I had just a lot of extra skin like in the armpit and in the back. So I'd had an upper back lift and a revision to the upper back lift, but I still had a lot in my armpit.
Got it. Got it.
So like
Actually,
wearing, go ahead.
I was waiting for someone to bring that up because I think one of the things, so like the lady I did on Monday, we did her surgery. I think someone had asked, like, how do you know what to tell someone, right? That was one of the first questions we talked about. She came in wanting a reduction, and she was also a weight loss patient. I think she'd lost like 160 pounds. And the problem is a lot of women have this side tissue here, right? They actually, a lot of them, I think it's breast tissue. And so when they come in asking for a reduction, they're like, well, what about this here? You know, I think a lot of people call it their side boob.
Yes. Yes.
And it's very bothersome to wear. I'm not a woman, but I see a lot of this, right? So, and it's very difficult for them to wear their bras. Like I think, Ashlyn, you were just saying it like spills over. It's very hard to.
Fucking, that spot right here.
Yeah.
Yeah. Like just right there. Boom. See it?
Yeah.
Bam.
Yep. There you go.
So that's what we were trying to get at. And even though I had an arm lift, the arm lift, we had not gone down far enough, which I wanted him to do more of that one where it goes to the side and then you can pull some from here, but he wouldn't. So
yeah. And so the lady Monday, I mean, that's a good example, right? So she came in. It's a good example of what kind of listening to your surgeon. So I told her this stuff here is not your breast, right? Your breast ends in your, like if your arm is down, then you see where your armpit crease is. That's where your breast ends. Anything here, a lot of it is actually coming from the back. Like people who have rolls here, if you trace it, if you kind of like follow it back, it's usually coming from all the way up here from your scapula. And sometimes you'll have multiple rolls. And so I told her, I can do your breast reduction, but don't expect that to fix any of this stuff. I said, if you want that fixed, now this is where the 360 comes in. I said, you've got to do a 360. You have so much tissue here. There's no way anyone's going to be able to fix that for you with lipo, or any other type of procedure. And so she went ahead and did the 360. So we did an upper back lift and a breast reduction. And so that's one scar. It's not really a 360. It doesn't meet in the front generally, but it starts very close to the front here. in the breast crease, and then it goes all the way around, kind of in the bra strap line. So we sometimes call it a bra line lift.
So that's how you know if you, because you have that, right, Ashlyn, the one that goes on your back. And I know Bex does too. And she had an upper body 360 lift. How do you know, I guess, if you have bigger boobs and you want this to be gone, that's how you know you're going to need that upper part, right?
If you want
this gone, then you need to have the upper body 360 lift.
You need that or something, some version of it. So I've been doing something for probably about 3 years now. I keep saying I need to write it up every time I talk about it. And I've presented it at some of our meetings, but I call it a torsoplasty.
Okay.
And not everyone's a candidate for it, so it does require, seeing them in person. But essentially, instead of going across the back, all the way across the back, I go up and then into the armpit, and generally we'll blend it with a brachioplasty. And I can just pull this tissue up and up and in, I guess.
Oh, okay.
I started doing it because I had a guy who didn't
want. I got through multiple surgeries, which could have been done as one.
Yeah. It started because I had a guy, I had a guy patient, and I was like, well, I mean, you can't do a bra line lift because you're not gonna wear a bra ever or a bikini.
Yeah.
Right. And he's like, I like to go to the beach. I like to take my shirt off. So I started with a guy, I think 3 years ago, and then we've just started doing it on women because I was like, well, let's just see what happens. Yeah. And they seem like good candidates. And I think we've done 6 or 7 women now. Well, men and women. So been happy with the results.
Nice. Because I know, like, I'm the one that's not a big fan of scars. Like, I'll deal with it, but like, I don't like that big back one. Not gonna lie. Yeah. Not gonna lie, ladies. I love all my peeps that have it, but like,
the funny thing is, it's so easy to cover.
Yeah.
Like, it rarely comes up.
Okay. Good to know.
It's on the,
yeah, if you have a good, cause like I'll see online other surgeons, the problem is some of those back scars look like this. There's no hiding a back scar that's triangular. So you want to make sure your surgeon is putting them straight, putting them in the bra strap. So that's what I try to tell patients. I mean, I have lots of examples, and I have a woman who I did like 5 years ago. She was from Iowa. I don't know, some out of state place. Anyway, comes in my office 4 years after we did her back lift, and she was looking for other surgeries. And I was like, man, I'm happy you came in, because now I have this 4-year follow-up to show people, and you can really barely see her scar.
Which
it's still perfectly straight.
Terrible. It's wide. Yeah. I had it revised. It stretched again, and I think the doctor just explained he had a really hard time figuring out where to like tack it. I don't know if that's the right word.
The back and the chest in general is tough.
Amazing for the first month or two, and then I would wake up one day and it would just have like sunk, and then slowly after it's sunk, it would never separated. I never had any separation, bless you, of any of my scars.
Bless you.
But it just widened. But again, it's in a place where like the only like. Not that I wear much like backless items, but I guess if I wore a back, I have like a jumpsuit that has a lower back, and it may show my back scar, but like I really have zero feelings about scars. I'm sure people see my arm scars in particular. I don't scar well, so like that's not great, but like I don't know. If someone asks me what on earth happened to my arms, I tell them.
Yeah. Yeah. No, I mean, I've noticed even with Bex, like she loves her scars. She like, cause she has the inner thigh done too. So she has the inner thigh, she has the arm, she has the 360, like she did it all. Obviously not at the same time, but like she loves it and is so happy to have gotten them done. And for me, I'm like, I guess like in my head, I'm like, do I really care? Do I not care? Like I'm on the fence because like, I don't care at all about the bikini one. I don't know why I don't give 2 shits about that one. Maybe because I've had a baby. There's tons of random scars there anyway from the surgeries, like it doesn't, who cares? But like, I think that back one, and I think it's because I really, really want to wear a backless dress and I haven't been able to do it yet. So it's like, I kind of want to like get this lift done, put some pasties on, and then I can wear
the backless dress that I wore at the last Just Be You. You know, it was hilarious where that tiny string was.
Yeah.
That's exactly where so you couldn't, even though that was, and that was like low. I was a little nervous. That was a little low, too low at the back. But like the string that held the top up actually still went exactly where the scar was.
That's amazing.
Yeah, it just happened. That's
Maybe you
where
need
it
a
was.
torsoplasty, Mel,
Is that what
and
I
you
need?
can wear.
Yeah,
I mean, not everyone's a good candidate for it, so I can't make any promises. But
that's
I
okay.
think it's just really
I'll fly
hard
to
when you
Florida.
have like
We'll
the
figure it
back
out.
rolls, and I mean, I really got stuck too, where I felt like the front didn't match the back, and that was really starting to bother me. Where like the front was looking decent enough, but then the back, and then when I got my arms done, I felt like where I got stuck with my arms is that was the only place people could see that I formerly was obese. Like the rest
Mm.
of it looked good enough that like you didn't know, but you knew, especially if you could see my armpits were really the problem. If you could see in my my armpits, or I had like certain tops and stuff, like you could tell like, ooh, she was formerly much bigger than she is right now. And so I
Mm.
kind of got stuck on that in my head of like
Right.
that's the reminder that how I felt about it is that I did this to myself. And so to me, to get rid of that really helped, like to kind of close that as like, okay, like this is done and I can move forward. But really, I just wanted to wear t-shirts and bras. I couldn't wear pants for a long time either. I have a really, really short waist. And so I need to wear like junior, like a low rise, just because I don't have that much waist to begin with. It's
Yep.
just lower. And so if you have any skin there, low-rise jeans don't work for you, but I couldn't wear high-rise jeans. It just created this problem where I was just like, I want to wear jeans and a t-shirt and a bra.
You're like, I just want to be comfortable.
I just
Just
want to be
normal
comfortable.
stuff.
Yeah.
See, my
So,
goal is to be able to not have to wear a bra. That's where my goal is.
so should we talk about what happens with your nipples when you get
Well, yes.
you're gonna need to wear a bra, or your nipples are gonna be out all the time?
What? Really?
Well, we
No.
get cold a lot.
Isn't that like a side effect of
Just
being
nipples
No.
on at all times.
I mean, they're pointing to the front, which might be different, I guess. But
I cannot go braless, we'll just say that.
oh,
I
really?
just want to go braless
I have to
with
poll my patients now.
it's really just for like dressing up. That's all I want it for. Like I don't want to not an everyday situation, but I definitely want to be able to dress up and not have to wear a bra and feel comfortable. Because
they have they have like stickers for that, don't they?
Yeah,
Where you
yeah,
can
the
like
white
not wear a
sleeves.
bra.
I wear them.
Yeah.
Yeah.
Often,
Pasties. There
actually.
you go.
I find them more comfortable too, even in like, because what's really frustrating, like some of the Sheen stuff, fast fashion, I know we're not supposed to wear any of it, but guess what? We all do. So like, because that stuff is so thin, a bra often doesn't work with it because it's so thin.
Yeah.
So like pasties are actually better because they just smooth right over all of it. So yeah, I mean, I don't know. I thought that was like a side effect of surgery. Your nipples are just out.
No, I guess not.
I mean, not that I've heard.
You would know. That's funny. I thought that had to do with
I
surgery.
feel like someone would have complained at some point.
Because that would be annoying if they're on all the time. Like that would drive me a little nuts. Are your boobs on all the time, Ashlyn?
Mm-hmm.
Maybe we need to take a poll in the office. Start handing out some surveys.
Right?
No, and the thing is, I didn't have a lift or anything. I just had the implants.
That
Which I love. I know
maybe
people
I
get
could
really
see that.
cranked about implants. I know people are like, oh, they're terrible. I love mine. They're like my best. They're like my most favorite thing I got of all of this. Because again, I think too, that has to do with my trauma of having the most non-feminine body there ever was, like the big rectangle that was apple on toothpick. So like, yes, I think that was able to feminize and also kind of even me out to show like very.
Yeah, and a lot of us that were bigger didn't know they even, like I was a box. Who knew there was like curves underneath this thing? Like I had no freaking clue. Like I totally
didn't
get
have
it.
them, but I paid lots of money to acquire them.
Well, here's the thing that I think I've always wanted this question answered, and I don't think it'll offend anybody, but Dr. Beidas can definitely help me with this one. Have you noticed when you do like the tummy tucks and the lower 360 things, have you noticed that women that have had children, like they're more likely to have like their hips are out, right? Like, cause they have to do that for us to push a baby out. So like Ashlyn hasn't had kids. So is that why she doesn't have like those hips that come out? Or is that just because like her genetic makeup? Like, how does that work?
Yeah, that's a great question. I mean, I think obviously a lot of it's going to be genetic. Certainly that can contribute to why someone would have smaller hips, but that's also how she was built. I mean,
Right.
I don't, maybe if you go back and look at pictures when you were younger, or maybe before you were overweight, you still looked
Yeah, I'm
squarish.
pretty sure I was rectangle
Very
rectangle
rectangle.
from
Yeah,
birth.
so that's genetics, right? She's not going to
Yeah.
change that.
Yeah.
Um,
But
Yeah, but
with
it's hard. I mean,
but if she
I
had
don't
a
think
baby, would
maybe,
it do
maybe
anything?
it could, it might.
Okay.
knowing
The
my
other big thing
beloved
in
pelvic
body contouring now
body
that's
was-
coming out of South America is rib contouring. So where you kind of go in and fracture some of the lower ribs, and then you can narrow that, kind of cinch the waist. And so for someone like
Yeah, I
you, that
probably
sounds
would
like
benefit from it, but I would be put in the loony house if I came home and was like, so I'm not gonna remove the rib. We're not going to Turkey. We're
no,
not
there's
gonna
no
remove the
removing.
rib. We're just
Just
gonna
just
shave it down to make it look more feminine.
That is wild. That is
I,
wild. But I
I
do
would be
know
taking
women
it.
that do that because they don't have that shape.
I would so
Mhm.
sign up if you ever have to do that again, but with real bodies instead of cadaver. Like, sign me up.
Sign her up and
I
then
did the course. I've done the course. I went down and did the course
No,
in
I remember you
Miami a few
told me
months ago.
because I was like, what is that about?
well, and we know some people that just got their eyelids done.
Yeah, I
Yeah.
noticed that, but she got it paid for by insurance, so she must have been. My mom had it done too. Like, she's cool with me saying that, and I'm probably gonna have to have it done eventually too because we have the same kind of eyes. It like literally is taking her vision away.
Oh no. That's a whole thing. Because yeah, it's what is it called? That over
Like where it's hooded.
yeah,
Yeah,
the hoods. I have hooded eyes. So like it makes it a bitch to put eyeliner on sometimes. Like
Yeah,
it's never the
insurance.
same.
I think insurance pays for it if it's obstructing your visual field, we call it, right? So if your eyelids are so low that you can't see, usually your field is blocked upwards,
Okay.
then they'll cover it. Um,
Do you do
again,
that?
it's not one of I don't really do much eyelids. I mean, I just really don't do much above the neck. The occasional thing I'll do is some neck lipo, but it's usually with something else. Um, and I'll occasionally do upper eyelids, but if I'm doing something else,
Okay. So that's not your jam.
okay.
not my
Question
jam.
on necks.
Question
How do
on
you
necks.
remove skin? Like, so like the skin we get like right here, where it's like
I
you
knew
can't. You knew I was going to ask about
I
this.
knew it.
All right, because it drives me nuts. I
It
keep
does.
making videos from the side, and I'm like, oh, there it is again. But you can't see it from here, so
Right.
it's not like it's. I don't know. It's like, is that a direct where then they go in and I mean, one hell of a scar.
But what was your question? Well,
Okay,
shoot,
for
then.
necks,
Yeah.
where do you end up putting scars? Maybe that's better. Like versus
Yeah.
like up here
Well,
versus
so
like
usually a
direct.
neck lift, the scar is it's going to start around the ear, right? I mean, it's kind of the neck part of a facelift because usually a facelift is also going to come with a neck lift. So it's going to start here, going to go behind the ear, and then into the hairline somewhere, and then that's where you lift the neck from this way, and then you do the same thing on the other side. But
Oh,
usually it's part of a
interesting.
facelift. Yeah,
Which I need one of those too.
No, you don't.
yeah.
Your
The
face
I
is
mean,
fine.
My face
the
is
other,
driving me nuts
and
so
again, I
much
don't
right
do
now.
many neck lifts, but I do a lot of lipo of this area, and then we'll do like some skin tightening just to you kind of point it exactly at the area that we're
Yeah.
usually targeting, which is kind of this like submental area we call it. And for most patients, that's usually enough. Might buy them like 10 years until they really need a facelift at that point, and then you can get everything cut and lifted.
It's freaking wild. The
Are
things that you
there
can
like
do.
weight loss? Are surgeons that specialize in facelifts after massive weight loss?
Good question. I don't think so, but I don't know that it necessarily needs a different approach than a standard facelift because I think that just accelerates aging. I don't think it does anything to the tissues. I mean, yes, you kind of expand and shrink, um, and you probably are going to take more skin off, but I don't think, I used to do facelifts on weight loss patients. I just don't do as many anymore, and so I kind of just stopped doing them because I don't think I'm going to get the best result for someone. So, um, but I don't think you have to go to someone who does a lot of weight loss patients. I think
So
the
in that
techniques are
case, it's
generally going to be the
more
same.
important that they do a lot of faces
Correct.
or
Go to
exclusively
someone
faces.
exclusive. Yeah. So I send my patients to a facial plastic surgeon in town.
Who
And
is
that's all he does, face and neck.
Ashley.
Sorry.
who is it?
Dr. Sagal, Kapil
Oh,
Sagal.
mhm.
He's in Winter Park right off of
Of
I-4.
course she knows exactly who this is. She's already probably like Googled him, checked out his website, wanted to maybe almost do a booking an appointment for a consultation.
No,
No?
I gotta pay off some debt, girl, and my teeth are nice.
Your teeth?
So yeah, but he's a facial plastic surgeon, so he does nothing below the neck, right? So someone who's going to do a lot of faces, a lot of noses, things like that. And I haven't had anyone complain. So
That's good.
yeah,
That's good. So it sounds like basically, guys, if I'm going to recap here. So basically we need to talk to our surgeon, go thoroughly into what we actually want, and don't go off of what they want to do to you. Make sure it's what you want done. And really go over like, hey, like this is what I like wear on your body, like point things out so you can get the right procedure done.
I think so. I think the other thing I would add is, you know, try to go in more with an open mind. I think I'm not necessarily saying weight loss patients do this, but in general, patients sometimes come in saying, I want a tummy tuck. I want lipo. Well, okay, that's not really, no offense, that's not your kind of decision to make. You might want lipo, but you might want your diastasis repaired. Well, there's no way you can fix that without a tummy tuck. Or you might have a lot of loose skin, kind of like Ashlyn. You went in for cool sculpting. Someone should have told you this is not going to give you the result you want. So
Yeah.
I would say go in with your problem list,
Okay.
and then keep an open mind. And also, like I said, I'm always going to tell someone, hey, I know you're coming in and your loose skin on your belly bothers you, but the loose skin on your belly extends all the way around. Or same thing with the breast. Like you want a reduction and I can do that for you, but it's not going to fix this part here. So it's not necessarily that I want to do that for them. I just want them to understand that this is only going to fix part of the problem, or you're kind of narrow-minded here, narrow focused. I want you to see the big picture of like, yes, I can do the reduction, but it's not going to fix this. So be aware that if we do that, you're not going to have that kind of outer bra area fixed.
Like
Okay.
maybe more
No,
focusing on the like what's the problem area and like what is it causing. So like when I went in, it was like it's really hard for me to wear a bra. They might have talked to me about both the armpits, the back, and the front, and how that all goes together. And that I know you're taking a picture. You won't get me with some crazy faces.
I know. Boom. There we go.
There we go.
Keep going.
Versus like I know I need, because I hadn't even heard of a reverse tummy tuck, so it never would have occurred to me to be like, but the skin under my bra line was very bothersome. So maybe too I should have asked more for like, I wonder if there was an aspect of it that he didn't want to offend me, or he didn't want to something, or he was an incredibly nice guy, or he thought I was young, or like I don't know. I'd
Right.
love to pick his brain now and be like, why did you pick a appendectomy?
I think that sometimes I wouldn't say pricing. I feel like I offend people with pricing. I feel like usually they ask for quotes and we give it to them, and usually it's either like, oh yeah, I was expecting this, or hey, this is like way out of my budget and let's kind of reel things back. But I will say one of the things I think is hard as a surgeon, and maybe even especially as a male surgeon, like Mel, you mentioned this earlier, breasts are asymmetric, right? Well, some women may have noticed that, but maybe aren't as like keen. They're not looking at their breasts all day, every day, right? Naked. And so I feel like I'm constantly telling someone, patients, like, hey, I'm not pointing this out to make fun of you, but you've got asymmetries. Everyone has asymmetries.
Yes.
Here's what I'm noticing on you. This fold is here on the left, this fold is here on the right. Your nipples here on the left, your nipples here on the right. So I do tell patients, like, this is what I'm looking at, and these are the things I want to fix when we're in the operating room, or at least improve. And I think, I probably deliver it much differently now than I did like 7 or 8 years ago when I started in practice. But I think it is tricky to navigate that and make sure you're not, you don't offend someone, I guess.
Yeah. But I think as patients, guys, when you're listening to this, like, we need to make sure like that's out the window. We can't be getting offended about our body and like where the folds are or where things have to be nipped and tucked and transferred, because like it just is what it is. And if you don't know that asymmetry is a thing, like it is. Like, like your right side does not match your left side. Like, it's as close as it can, but even your eyes are a little bit different. Like, I know one eye is a little bit bigger, a little bit lower than the other. I know the same thing with even my arms, my right dominant, same thing on the other side. Like, and it just slowly goes down. Even with my legs, it's funny because like my right leg is technically smaller than my left leg, but my left thigh is smaller than my right thigh. Like, it's opposite. So it's like your body just balances you out as much as it can. So, just try not to get offended and try to just be open and honest with your surgeons, because I think that's the only way you're going to get the best result, is to literally be just completely open. Like, they're going to see you naked. They're going to be literally in your parts. They're messing around with your muscles. They're messing around with your skin. They're pulling, they're moving stuff. Like, I know that was one of the parts that was scary for me, is like, I don't know this surgeon from Adam. Like, I'm like, why would I let this guy touch me? But now that I know surgeons and know who they are, I'm like, oh, this is a little bit different. And you're not looking at us sexually. This is your job. This is your profession. It's not like you're trying to get a date from this, like,
Which is so funny. It never occurred to
Some
me. I
people
feel
might,
like it's
but
at
no.
the OBGYN. It's like, this is their
It is.
job. Hello, yes, you're going to have to pull this. You're going to have to tuck this. You're literally going to be like, so your mom's pubis, or what it was, the like top of your vagina.
Mom's
Tell me about your thoughts. I'm surprised that didn't come up today.
Well,
Like,
it has now.
clients who are like, how do I tell them that part? I was like, point to it. This
You have
part
to point. Yeah.
bothers me. Can
Yep.
you fix it? How do you fix it? What do we need to like ask? But I have clients that are like, well, it's just such a strange thing to ask about. I'm like, almost every
We
weight
have-
loss patient has extra skin there. That's how bodies work.
Yeah.
Like, it's okay.
Yep.
They're probably gonna fix it or think about it anyways, because they got to figure out where the scar pulling up and down and all
Yeah.
that. But if you don't tell them that bothers you, or what it bothers you, like in a bathing suit. I have a lot of clients that are like, in a bathing suit, it's the thing that sticks out now. And I'm like, that sounds like something that sounds like you should fix.
Yep.
I've had men ask me about that area, right? Because even weight loss men have the same problem. Everything is sagging, right? So, yeah.
Oh yeah.
I can imagine men would be self-conscious about that too, because it
Yep.
may drape over and then it doesn't look as.
Yeah, but then if they get the surgery done right, then everything's all uptight, ready to go. Like, nothing's hiding. So,
And it's not always on. So,
and it's not always on, like the nipples. So that's, although that's an Ashland thing, guys. That's not everybody in the world.
I don't think that's true for everyone.
Because, like, I know after, this might be TMI, but like when your nipples are hard for a certain amount of time, like it kind of hurts. Or is that just me? That could be amazing.
I wouldn't know.
That's true. You wouldn't know.
It just kind of is what it. I don't know. I didn't. That's funny.
It is
You
funny.
didn't ask for it.
Yeah, you didn't ask for it. You didn't ask for your nipples to be turned on all the time, but they are. So
there we go.
Yeah. Now, before we leave, I just want to make sure we get the nipple. I have to ask something about the nipple. And I know that we're going to have a nipple and belly button conversation, but when you're there though, do you like...
Is the question for me or Ashlyn?
It's for you.
Okay.
Okay, this is how I'll explain it. When they redid my leg, like he wanted to test my leg in surgery to make sure I didn't get compartment syndrome, right? He was like messing with my leg to make sure it could move, my toes are good, everything's going. So like, Are you...
They were using analogies now.
Yeah. So are you doing that with the nipple? Like, are we making sure it still works? Are we making sure it has like, function? Like,
I know
do anything like
absolutely obsessed with blood flow to that, like blood flow.
Yeah. So usually for us, in a straight aug, that's almost not a concern, right? Unless you're putting in gigantic implants, which is not the case. But usually the highest risk is a reduction.
Okay.
Because you are moving, say, a nipple it could be down as low as the belly button all the way up to the top of the chest. And so as Ashton said, the blood flow is really what we're concerned about.
Yes.
And so there's a few ways to test that, even in the OR. One obviously is looking at it, right? Is it bleeding? Is there color? Is it normal? Is it dark? Is it pale? So pale or dark are both bad. They just mean different things. One is not enough blood flow in, one is not enough blood flow leaving. It's just kind of full of blood. And then one of the ways we can test that is kind of like cap refill, like when you take your thumb, trying to put my thumb here, and push down and then release, it's going to quickly get that color back. And another way is just taking a small needle and kind of pricking it to make sure it's still got some blood supply.
Nice.
And then if that's the case, if it's got poor blood flow, then there's a few things we can do. One is use medications to help kind of dilate the vessels. And the other, and sometimes we kind of go straight to this, like my patient today, we do what's called a nipple graft. So we kind of take it off as a skin graft and then sew it back on. The problem with that, it's not a risk, but the problem is, A, now you lose sensation because you've severed it from all the nerves, and B, you can no longer breastfeed because you've severed the ducts as well.
Yeah. See, that's
so it's just there.
The worry.
So it's just there. It's just there kind of aesthetically, but it serves no more function at that point.
Which would make me very upset.
Yeah. So we warn all our patients, if you're having any kind of breast surgery, at least a lift or reduction, there's always a risk of that. Let's say I've probably had to do it in the like unplanned, right? Most of the time, like today's patient, I told, hey, we're doing grafts for you because your nipples are down here and you want to go down from a G to a C. I would say an unplanned, I think I've done it twice in 10 years.
Okay.
So pretty rare. And it's usually, and I think the two patients for me, and we have this conversation that I'm having now that I'm telling you guys, like, it's usually someone who's had a reduction in the past and we don't know where the blood flow is coming from, or they've had a lift in the past, or they have implants and now we're doing a lift and switching out implants. So it's someone who's had other work done in the past.
Okay.
And so their blood flow is unpredictable. And we have that conversation where I tell them like, hey, we're going to try everything we can to not do a graft, but if we have to, then we will. And usually these are women who are in their, 50s and 50s, 60s, for example.
Gotcha.
So breastfeeding is not a concern, but certainly the sensation can be a concern.
Yeah. Okay. See, you do test it. I'm happy to know
we do
that.
test it.
I am, because I'm sorry, I like my nipples. So I'm like, I want to make sure they still function afterwards.
Yeah. And again, for someone who's never had surgery, if there's a concern over doing too much at once, like, especially for a weight loss patient, sometimes we stage some of these surgeries. So I saw a woman last week. She wanted a lift and aug, and something else. I can't remember. We were doing a lot of other things. And so I told her, well, let's stage it. So when we do your tummy tuck, we'll do your breast lift. And then we'll come back when we do your arms, I think. And I told her, we'll do your augmentation with an internal bra.
Oh, there you go.
And that plan made sense because then we can get the breast lifted nicely, get everything set. And so you kind of less is more in that situation because you can get a better result by splitting it into two.
See, and this is why you talk to your surgeons about what you want to do, because he can literally stage it so that it does it like super smooth. So you're not feeling like you're being chopped up with no good results. So,
yeah.
All right, guys. Is there anything else we should tell them about navigating their consults?
I think I've already overshared enough.
That's fair. I think I have too. Yep. There's a lot on this episode about Mel that never thought I would say.
Oh my God. We should put a disclaimer on the beginning. If you're one of Ashlyn's clients, don't listen to this.
Don't listen. I love it.
We should have a poll about the nipples, though, I feel like.
I think when this comes out, we're definitely going to do a poll about the nipples. I need to know I'm not alone with wanting my nipple sensation intact. So.
No, I think you're not alone in that. I meant
no, my poll, if that's a common issue post.
Oh, yeah, they're like on. Yeah. I'm going to ask I'm going to text.
Part of my surgeon told me that was like a part of, when I got the consult, he was just like, hey, this is the thing that normally happens. And I was like, oh, okay. Guess I'll have to wear a bra.
Guess I'll have to wear a bra. I'm going to ask Bex. I'm going to text her right after this and be like, are your nipples always on now? Like, what's going on?
Please let me know after because I'm curious.
Yeah.
Maybe it's a special technique or something they do. I don't know.
No, I definitely got the cut the holes, put them in, sew the hole. There's nothing special, and one of them flipped. So whatever is.
Wait, your nipple flipped?
No, the implant.
The implant.
Okay.
Flipped,
and I've had 2 surgeons try to fix it, just like in office, and they're like, okay.
Oh, okay.
Oh, it's still flipped.
Yeah, to this day.
Oh.
Is that?
It doesn't look. You can't tell unless you know what you're looking at, and it hasn't. It's not where the back button, where the back buttony part is in the front, so you can't see that. It's just there's the fullness onto one side looks different than the other side.
Okay,
So
that's not a big deal.
Do you have a round implant or an anatomy? I feel like we're starting a whole new series here.
I know.
It's a high profile. It's a
Round,
yes.
not anatomic. Huh.
No, I wanted a teardrop, but he said no.
Yeah, well, I don't do those either.
That's a no, apparently. No teardrop boob drops.
Well, the teardrops are textured, and that's a whole other
Right, which
conversation we can
back
have.
then we didn't know that was a bad thing. That was
That
back
was a bad
before they
thing.
all came out,
Yeah.
and you don't want those. No.
But now the newer implant it's been out in the world for like 14, 15 years now, but it was recently approved in the US. It's been almost a year. So I've been using them maybe for about 7, 8 months. Their technology, it's not textured, but they have 2 types of implants. So kind of, Mel, as we were talking about earlier, like some women want the fullness up here. Well, some want volume, but they don't want the fullness up here.
Yeah.
And so Motiva, which is this new implant, they have one that keeps the roundness when a patient's sitting up, and another one that kind of does more, kind of simulate this here. It's going to pop out more here, so it's less full up here and more full down here as you sit up.
Is that the one that specifically only plastic surgeons are allowed to use and cosmetic surgeons are not?
Yes.
Good.
Yeah, Motiva and Sientra, as far as I know, is the same as well. But Motiva is the newer one in the US.
I saw a funny one where the one doctor was like, I never use these and this is why. And then someone else was like,
Kelly Kylene.
Yeah, it was like, the reason that you don't use them is because you're not allowed to. And I was like,
Kylene did that video. She's a great surgeon.
No.
Yes, call them out. People that should not be using things that are not in their specialty. That's bottom line.
Yeah, well, and he was making it sound like he didn't like them for whatever, XYZ reason, and it's like, well, yeah, you don't like them because you can't use them, you don't. Yeah.
It was a very funny. I'm like, what are they talking? So I got online. I'm like looking it up. I'm like, oh, that's interesting.
Yeah.
Why did the manufacturer just do that for like protection, or there's something to it where they want you to like evaluate further before utilizing it in certain people?
I don't know. A lot of those, like Sientra has done that for some time too. That's the brand I used before I've switched over to Motiva. Hope it's for ethical reasons. I mean, certainly it's not financially driven. Otherwise, they would sell to everyone because they can make a lot more money. But I like that. I respect that. I think that's a great tool. I'm surprised more plastic surgeons don't use those 2 brands. They're actually probably the 2 with the lowest market share, believe it or not.
Interesting.
Even among plastic surgeons.
Yeah, I think I have the one that begins with an N.
Natrel, so Allergan. Yeah, which is AbbVie is their like parent company.
Mm-hmm.
And Mentor is Johnson & Johnson.
Huh. No, Johnson & Johnson's in the implant game, huh?
Yeah.
That does not surprise me.
Hips and stuff. They do a lot of interesting, like we think of Johnson & Johnson as like on the like shelf in the grocery store, but
there's a lot to them. All right, that could be a whole nother one, guys. We can keep talking forever. So I will go ahead and wrap this bad boy up. So remember to follow us, and you guys will get to see all the behind the scenes. You're going to be able to ask any questions you guys want. So remember to put those in the comments. We will be watching those. We will be answering those. So be on the lookout for more episodes, because this is only the 4th one in, and we have plenty more coming your way. So I hope you guys have a great night, and thank you for hanging out with us.
I don't remember agreeing to the behind the scenes.
Too late. Already been recording random things. Alrighty, guys. Have a good night. Bye.